Hey, this is thewheeldalemuffett. This is just a very quick episode to follow up on last week's episode, which was why am I in so much pain? Well, I posted the video on YouTube, obviously, and on Facebook in a group for spinal cord injury patients as well, and I got a lot of really interesting feedback about how they deal with it, what they do, different things that are out there. So I thought it only made sense to use all this information while it's sort of fresh and create a little follow-on video just to talk about a few more things. So first of all, I want to talk about something that I think I left out in my last video really, which was what does my pain feel like? So neuropathic pain for me comes in two ways. I get sensitive skin and I get sort of muscular pain. My sensitive skin happens at the top of my thighs here. It's like a real burning hot sensation, but it's incredibly sensitive to touch. So if anything touches it, that really hurts. I sometimes have to lift my bed sheets off me and just make sure they don't touch me. Sometimes if something cold touches it, or like a drop in the shower, like that can be excruciating. So that can be very difficult, but it's not all the time, it sort of comes and goes. Then the muscular pain, that's quite different. So this is deep in the leg. This feels like almost like a stabbing, deep sensation. It's like real hot burning, kind of almost like an electrical sensation is another way of putting it. And that can be really, really painful. It varies in strength, so sometimes it's more like pins and needles. It's not that bad, it's quite tolerable. Other times it's incredibly strong and I'm like grabbing the headboard like, oh my God, please stop. And it's very, very difficult, different ends of the scale. So yeah, it's quite difficult. To go back to some of the comments that I had, so a lot of people mentioned that they have experienced neuropathic pain for the entire time since their injury, and for some people that's sort of 20, 30 years. So that shows for me that you have to learn how to live with it. Apparently incomplete injuries are worse, and normally complete injuries not so bad. So I think it's such a big part of the spinal cord injury world, and it's such a big part of our lives now that we have to learn to live with it. And there's different ways of doing that. So one of the obvious ones is medication. In my first video I talked about pregabalin and gabapentin as two that I've tried. I've recently just tried amitriptyline, which did wonders for the nerve pain but turned me into a zombie. So unfortunately the side effects for me outweigh the positives of the neuropathic pain. There are some other drugs that people have mentioned in my groups, so let me just tell them. There's diazepam, Valium is a muscle relaxant, lamotrigine and duloxetine. I'll spell them here because I have no idea how they're said. But I'm not recommending any drug because I'm not a doctor. But what I am recommending is if you're uncomfortable with your nerve pain and you're not happy with your medication, speak to your GP, speak to your doctor, go find out other options, try different things. Don't sit on something that's not working. Try different things and see what else you can do. You never know, something might work out better. I got one friend who he's been injured for 20 years. He said that recently he went through the process of trying different medications. He's found one that works. And he wished he'd done that years earlier. So really go speak to your GP. Don't be afraid to ask to try different things. In a worst case scenario, you go back on what you're on before. Couple other things that really help people in the comments, they said that keeping busy, distracting yourself. I also realised that on days where I'm really busy and I'm doing loads of things, I don't have much nerve pain. So try and don't let the nerve pain stop you from doing stuff, because I think it can almost help. Doing stuff helps a lot. So you'll fight through the pain to go out doing stuff, and then often the pain disappears. One person mentioned acupuncture, not something I've tried, but could maybe be interesting. And then another one which keeps coming up is mindfulness. Breathing through relaxing yourself, using those methods, they can be brilliant, and a few people have mentioned how that can really help them. So I'm no expert, but I'm going to draw together some resources, and I'll probably do an episode on that soon to see, direct you into a good place to see if that might help. Cool, so just a quick follow-on video, nothing crazy. If you have any questions, obviously ask them. Any discussion in the chat is always great. So yeah, I look forward to the next video. Cheers guys, bye.